So next, good evening guys. Next class is pre-op and post-operative care. So pre-operative care means pre-operative first management is pre-operative assessment we should do, then pre-op preparation and pre-medications. So just image when you are working in surgical ward, what are the assessment you are doing, what are the preparation you are doing, what are the medication you are doing. So first is pre-operative assessment is done. The purpose of pre-operative issue and taking history and physical examination, risk assessment and common causes of postponing surgeries. Then what is the purpose is pre-operative visits, let's say establish the so establish report with the patient. First we can report with the patient tomorrow is surgery like this, taking history, then special investigation means CBC and LFT and all, then assess the risk of anesthesia and start pre-operative management, discussion with the pre and post plan of the anesthetic to avoid the any drug indications induction or not, introduce the treatment to yearly post-operative period, then history taking, chart review, present illness, family history, any malignant hyperphagia, so abnormalities, everything we can. This is any serious respiratory dyspnea, so orthopnea, angina, MI, anything is there like this. The hematology disease means anemic, clotting factor and all we can use. Musculoskeletal disease means rheumatoid arthritis, renal disease means renal failure, anything is there. CNS means seizure and stroke and ICP, anything is there. Then GI means liver disease, hepatitis, vomiting and all. Endocrine disease means diabetes mellitus. So patient have any allergy to drugs and all. Then sore throat, headache, post-operative nausea, vomiting, then expose of allothone within 3 months period of surgery, then DVT, respiratory problem and tracheal intubation and all we can ask. Then any allergy drug, food, antibiotics, anesthetic and all, then HIV, AIDS, anything is there. Then we can, if you're otherwise before doing investigation, we can check. Then taking a method of infect to the patients, that one. Okay. Sorry, two slide came. Then physical examination. Full physical exam must be done for minor surgery. Generally, color, activity, weight, and TIT, type of breath, and pulse volume, rate, pressure, heart sound, then breathing sound, chest and airway, trachea, then tracheal intubation, then mouth means cervical spine extension and all. CNS means cranial nervous examination, high examination, peripheral sensory, motor dysfunction. So routine examination, urine analysis, CPs, then medical less than 4 means HP sugar in urine. For glucose and all we can check for diabetes patient. Then patient have more than 15 years means HP sugar in urine, chest X-ray, ECG and all. So any medical disease we can take. So causes of death due to anesthesia we can take consent. Inadequate pre-operative assessment, inadequate supervision monitoring. So we can face disease and all. Okay. So common causes of post-opening surgery means acute upper respiratory tract infection, untreated medical disease, inadequate restrict of inpatient in emergency for fluid and all, patient sudden shock, then recent ingestion of the food, then failure of consent, then MI. Okay, then pre-operative preparation of the surgery and anesthesia. So history, physical examination, investigation and fasting, then information to the patient, patient family and all, then collect the blood, collect and prepare the blood products and staff, equipment, everything to organize. Then BP should not be more than 100. Then control the cardiac disease and fasting sugar 130 to 180. Blood preparation, major surgery, drug may be given the day of the operation. So steroid, heparin, antibiotic and insulin and all. So pre-medication means anxiety or fear to reduce. Then reduce the secretions. The hypotonic affect the anesthetic agent. So reduce the post-operative nausea, vomiting and reduce the amnesia and reduce the volume to increase the pH gastric content and reduce the vocal reflex and limit the sympathoretinal responses. Then anticholinergic means they're using for sedative to the patient, so that time they can use. Prevention of reflux of bradycardia to treatment of the bradycardia. Then side effect. So side effects means normally the drugs is CNS will be there. Then reduction of the lower esophageal will be there. Tachycardia will be there. So muscles numbness and muscles paralysis will be there to offer sedations. So visual impairment, then pyrexia, excessive drying will be there. So mainly there is a immediate phase, intermediate phase, convalescent phase. Immediate means post anesthetic, then intermediate means hospital stay, then convalescent after discharge of the full recovery. Okay, that is first phases means so immediate recovery phases to require the nursing care and detect the early signs and complications. So the patient is record operating room to plan and post-operative care. So the surgical patient immediately after surgery require to close monitoring. So then first that time what will do nursing management assess the patient to assess the patient saturation, pulse, depth and colors and everything. Okay, maintain the patient airway. So pulmonary ventilation to prevent the hypoxia and hypocapnia. Okay, then provide oxygen and respiratory rate and depth and all everything. So maintain the cardiovascular stability means so patient mental status, vital signs and cardiac rhythm, skin temperature, color, urine output, central venous pressure, so arterial lines and pulmonary artery pressures and all. Then what are the complications will be there? Hypotension, shock, hemorrhage, hypertension and all will be there. Then relieving the pain and anxiety means opiates we can give. So assess the managing of the surgical site means to observe the any wound site, any bleeding and any drains and all is there means. So assess the managing of the gastrointestinal means nausea, vomiting is common after anesthesia. Check the patient paratise movement. Okay, then assess the managing of voluntary voidings. So urine retention after surgery is very important. So opioids and anesthesia and all preparation of the bladder fullness. Then complication means shock. Shock is decrease circulating of the blood volume, otherwise tissue permission to impaired cellular hypoxia. It's lead to death. Then hemorrhage. So escape from the blood vessels. So that is one. Then deep vein thrombosis. So pelvic vein and lower extremities get after hip surgery. So deep vein thrombosis will be happen. Then pulmonary embolism. So obstruction of one or more pulmonary arteries that ornating to the venous system, that is right side of the heart. Then urinary retention, then intestinal obstruction. So result of partial or complete impairment of the muscle spasms. Then what are the causes of complication of death? Acute pulmonary problems, cardiovascular problems and fluid degarments. Then preventions, recovery to anesthetic responsibility towards to cardiopulmonary function, then surgeon responsibility towards the operation site, and train a nurse to handle the instruction and continues the monitor the patients. So discharge from recovery should be after complete stabilization of the cardiovascular, pulmonary and neurological function, which is takes 2 or 4 hours. If not, special care in ICU. Okay, this is a normal pre-operative and post-operative.